बच्चे को बुखार है या कोई भी प्रॉब्लम है, घर में एक टैबलेट है, आधी तोड़ के दे देते हैं, क्या ही हो जाएगा। ट्रस्ट मी, दिस थॉट process has sent children to emergency rooms. Children are not small adults. Their liver enzymes are different, their kidney function is different, and their brain barrier is also different. A medicine that is completely safe for you can be toxic or even fatal for your child. Today I am covering 6 of those medicines which are given to children by well-meaning parents that should not be given without proper guidance. Every parent and grandparent need to watch this fully. Hello, this is Dr. Udditaa and welcome back to my channel Pharmascope 24/7 on series Pharmacist Reacts episode 4. Medicines you should never give to children. Why children react differently to the medicines? Before the list, let me explain the science quickly because it changes everything. Children's body process completely differently from the adults. Let's see how. Number 1, liver enzymes that mobilizes drug are not fully developed in children until age 2 in some cases. Number 2, kidneys that eliminates the drug matures gradually through childhood. Number 3, the blood-brain barrier, which protects the brain from chemicals, is more permeable in young children. Number 4, body fat percentage and water composition is different, affecting how drugs distribute in the body. This means adult drug doses are never scaled down directly for the children. And some medicines have mechanism that is definitely dangerous for developing organs. These are not rare medications. These are common little medicines that are sitting inside your medicine cabinet right now. Medicine number 1, aspirin. Disprin is everywhere in India. Aspirin, Disprin. Aspirin is absolutely contraindicated in the children under 16 years of age. Here is why. A condition called Reye syndrome. When a child has viral infection, flu or chickenpox and given aspirin, it triggers a rare but devastating reaction. Reye syndrome causes rapid liver failure, brain swelling, and leads to coma or death within days. This was major drug discovery in 1980s, after which aspirin use in children dropped dramatically in Western countries. But in India, Disprin is casually given to children for headache and fever. For children's fever, only paracetamol, crocin, Calpol. That too with correct weight-based dosing. Never aspirin, never Combiflam, at least under age of 12 without proper guidance. Medicine number 2, adult cough syrup. Benadryl, Corex, Fencidil. These are given to children constantly, especially at night when parents are desperate for the child to sleep. Here is what actually in them. Codeine and opioid present in Corex and Fencidil. Chlorpheniramine, strong sedative antihistamine. Alcohol, yes, actual alcohol in some formulations. In young children, codeine can cause respiratory depression, breathing slows dangerously, sedation so deep the child does not awake. In children with specific genetic variation, codeine converts a morphine at 10 times normal rate, potentially fatal. The FDA banned codeine containing cough medications for children under the age of 12. CDSCO has issued warnings too. For children's cough, only pediatric formulations prescribed by doctor. Saline nasal drop, steam inhalation, and honey above the age of 1 year is still safe at the first step. Never adult cough syrups. Never. Medicine number 3, ibuprofen in infants under 6 months. Now, ibuprofen is used in children above 6 months but under strict weight-based dosing. Calculated weight-based dosing. The danger situation is giving it to infants under age of 6 months. In young infants, kidneys are still maturing. Ibuprofen reduces blood flows to the kidneys. And in infant who is already dehydrated from the fever, this causes severe kidney injuries. Additionally, ibuprofen should never be given to a child who is dehydrated or not drinking fluids, having chickenpox. It increases the risk of serious skin infection and any other NSAID simultaneously. For infants under 6 months, only paracetamol. That too calculated weight-based dosing. Doses in children are always calculated by weight. 15 milligrams per kg of body weight. That's the standard. Ask your pediatrician to write exact dose for your child's current weight. Medicine number 4, Fluoroquinolone antibiotics, ciprofloxacin, levofloxacin, or ofloxacin. These are broad spectrum antibiotics, very effective in adults. In children, they are generally avoided because fluoroquinolones affect cartilage development. Animal studies showed joint cartilage damage in growing animals. In children whose bones and joints are still developing, this is a real concern. They are only used in children in very specific and very particular situations with no safer alternatives under strict medical guidance and supervision. The dangerous scenario in India, child has loose motions or infection. Parent buy ofloxacin or ciprofloxacin or norfloxacin from medical store. Gives it thinking it's a strong antibiotic that will work fast. You could be affecting your child's joint development. For children's infection, only cefixime, amoxicillin, and azithromycin, as specifically prescribed by a pediatrician. Never self-prescribe antibiotics for children, ever. Medicine number 5, antacids with bismuth. Bismuth containing antacid, Pepto-Bismol and similar product. Less common in India but increasingly available online. Bismuth in children, especially during viral illness, is associated with Reye syndrome risk similar to aspirin, more relevant in India. Many traditional and herbal digestive preparations contain compounds that are not tested for pediatric safety. Gripe water, extremely commonly given to Indian infants. Traditional formulations contain alcohol. Some contain sodium bicarbonate, which alters infant gut pH. Fennel-based ones are relatively safer, but always check ingredients. So the rule, nothing is going in your infant's mouth without your pediatrician explicitly approving it, including gripe water, herbal drops, anything. Medicine number 6, adult antihistamine for sleep. Most shocking for parents. This is very common. This medicine, I need every parent to hear about it. Adult antihistamine like phenargans or promethazines are sometimes given to children to make them sleep. Promethazine is explicitly contraindicated in children under 2 years of age. The FDA issued a black box warning, the strongest warning possible. In young children, promethazine can cause respiratory depression, breathing stops, paradoxical excitation. Child becomes more agitated. In infants, it has caused deaths. I understand parenting is exhausting. I understand long journeys with toddlers are difficult. But this is not the solution. If your child genuinely needs sedation for medical procedure or extreme anxiety, that is a different conversation with your pediatrician. But this is not a home decision. So what to keep in your child's medicine cabinet? Now let me tell you what is actually safe. What every parent should actually have at home. Paracetamol suspension. That too, weight-based calculated dosing. Calpol or Crocin. ORS sachets for dehydration from diarrhea. Zinc tablets for diarrhea in children above 6 months. Saline nasal drops for blocked nose, that too of 1 year of age. Pediatric electrolyte solution, Pedialyte or equivalent. And the next most important thing in your child medicine cabinet, your pediatrician's number. Before any medicine, call and ask. 2-minute phone call is worth more. Your child's kidneys, liver and brain is still developing. Every medicine decision matters more than you think. If you are a parent, save this video and share this video to every parent you know. This information should be a common knowledge, but it is not. That's exactly why I'm here. Subscribe to Pharmascoop 24/7 if you have not already. Comment below and tell me which of the medicines surprised you the most. See you in next video. Remember, don't self-medicate.